Alcohol is a very common substance which is used in a lot of parties, and recreationally a lot of people engage in alcohol intake. What they fail to understand is that every single intake can lead to addiction. Especially the research shows that the younger the age of exposure to alcohol, the higher the risk of developing addiction. Now, alcohol as a substance leads to various problems at different stages of intake. The lesser the amount of alcohol, lightheadedness, disinhibition; higher the stages of alcohol, intoxication, and even can lead to pass out, and convulsions can also happen. What happens is, when you start taking alcohol in small quantities, eventually an individual will develop tolerance to it. That means the kind of high that the individual was experiencing, they will not develop that high at the same level of alcohol. So, they will end up using a lot more alcohol. This also leads to a lot of craving and urges to have more and more alcohol. So, let us say if an individual is taking alcohol once in a month, will not start taking it maybe once in 2 weeks or once every week, and eventually if they get addicted to the substance, it will lead to intake of alcohol almost every day. Some people think that binge drinking on weekends is not alcohol addiction, but in reality that is also a form of alcohol addiction. What also happens is that people start developing withdrawal symptoms of alcohol intake. Withdrawal can be anything like restlessness, anxiety, palpitation, tremors, excessive sweating. If the withdrawal increases, the people can develop delirium, which is called as delirium tremens clinically, and people can also have convulsions if they develop withdrawal and no treatment is given to them. So, these are all aspects of alcohol and its use. So, you had tolerance, you had craving, and you had withdrawal. Psychological aspect happens where the person is constantly thinking about alcohol and wants to procure alcohol in some way or the other, which leads to them not functioning in their day-to-day activities, which leads to maybe problems at work, problems at school, maybe problem in interpersonal communication. The family member sees them, they have a certain reaction. So, this leads to a lot of fight between the family members. We have also seen that people will start ruminating about the thoughts of alcohol, and they will have difficulties carrying out their daily activities. So, these are all factors of alcohol dependence or addiction. So, how do we treat alcohol addiction? The first step is talking to a health professional. They will help you understand whether outpatient treatment is possible or inpatient treatment is required. In inpatient setup, detox is the first step. Then second step is managing the withdrawal symptoms. We also have to look into the treatment of stopping the craving for the substance, and at the same time we take the help of a psychologist to help build the motivation. We also understand that other aspects has to be taken care of, like comorbidities, whether there is any liver damage, whether there is any other neurological damage. We have to take care of comorbid psychiatric conditions like anxiety and depression. Family intervention is very, very important. So, overall these are the ways how we treat alcohol addiction.